Oh. Our presenters today are Jenna Chisholm, who is a health promoter with the Eastern Ontario Health Unit, where she focuses her efforts on tobacco-related policy development and prevention strategies. She has been a member of the Smoke-Free Conservation Areas Working Group since the spring of 2017. Jenna is part of the East TCAN, who led the development of the Policy Progress Measurement Tool, which has been adapted to what will be presented today as the Smoke-Free Conservation Areas Toolkit. Samiha Versi is a public health nurse with York Region Public Health, where she focuses her efforts on tobacco-free and smoke-free policy development. She has supported several organizations in developing and implementing tobacco-free and smoke-free policies, and has consulted with a number of municipalities in developing and implementing smoke-free outdoor space bylaws. She's the chair of the Smoke-Free Conservation Areas Working Group, and actually I think she's co-chairing that group with Craig Mockham, who is the conservation areas contact that we have at Conservation Halton. Our third presenter will be Kevin Money from the Essex Region Conservation Authority, where he's the Director of Conservation Services. So I'm going to turn everything over to you guys now and let you take it away.
Wonderful. Thank you very much, Jane, for the introduction. I wanted to begin by saying Happy National Non-Smoking Week. I can't think of any better way to celebrate this week than by having a webinar on smoke-free conservation areas. Before I begin, I wanted to thank Jane and Conservation Ontario for inviting Jen and I to present at this webinar and for your ongoing support for this initiative. Jenna and I are pleased to be presenting this toolkit with all of you on behalf of the Smoke-Free Conservation Areas Work Group, which are made up of the following people you see on your slide. So the work group is primarily made up of staff from public health units who work on tobacco-related policy initiatives across the province. And as Jane mentioned, we are pleased to have Craig from Conservation Halton join our working group this year and is co-chairing the working group with myself. So the working group was formed in 2016 in response to the earlier smoke-free conservation areas policy work of Essex Region Health Unit and ERCA. As you know, ERCA was the first CA to go smoke-free, which Kevin will speak to later in today's webinar. Jenna and I recently presented a webinar hosted by the Central East Tobacco Control Area Network back in October. So we've included a link to that webinar recording as it goes in greater detail of the Smoke-Free Conservation Areas Toolkit that Jenna and I will be briefly highlighting in this afternoon's webinar. So you might be asking, why smoke-free conservation areas? Well, for a few reasons. There is support and momentum to develop smoke-free outdoor space bylaws and policies that go beyond the Smoke-Free Ontario Act. And for those of you that are not familiar with the Smoke-Free Ontario Act, it came into place in 2006, which was a law that where you could not smoke or hold lighted tobacco in all enclosed public places and workplaces. In 2009, expanded to motor vehicles with passengers under the age of 16. And in 2015, no smoking on and around children's playgrounds and publicly owned sports fields and surfaces. And more recently, it was updated to prohibit the smoking of cannabis in the same places where tobacco and the use of electronic cigarettes is prohibited. We've seen strong public support from people who smoke and those who don't smoke for more smoke-free outdoor spaces. And we've seen this increased trend over the last few years. More municipalities are creating or have created bylaws that have gone beyond the Smoke-Free Ontario Act to include other outdoor areas such as trails, parks, beaches, other tobacco, smoking, and vaping products, and more recently, cannabis. Some public health units are actually currently consulting with their local CAs in developing smoke-free conservation areas, so there is definitely that interest. We also know that there is negative impacts of tobacco on the environment and on health. Not only do they contaminate our water systems, but they are a threat to wildlife, pets, and children. Cigarette butts still rank as one of the top sources of shoreline litter and pollution worldwide. There's also an increased risk of forest fires from improperly discarded cigarette butts. As I mentioned, tobacco is has an impact on our health as well, and it remains the #1 cause of preventable disease and death in Canada, causing over 37,000 deaths each year. Another reason for us to focus on smoke-free conservation areas is that Public Health and Conservation Ontario have a shared common goal, that being healthy ecosystems and healthy people. So it really makes sense for us to be able to partner together to build awareness, develop policies, and lead initiatives to support each other towards reaching this common goal. So what happened next? Well, there was a series of consultation meetings with Conservation Ontario and conservation authorities to do two things: gauge the interest in smoke-free conservation area policy development, as well as assessing the needs of CA staff to be able to support smoke-free conservation area policy development. So Conservation Ontario conducted a survey with Conservation Authority's Communications Work Group back in April of 2017 to gauge interest of CAs in exploring the development of these policies. 89% of survey participants at some level indicated that they would consider a smoke-free conservation areas policy, and more than half of survey participants indicated that they would like to receive support materials for exploring or developing smoke-free conservation area policies. So our working group ended up doing the same thing with our public health units. We wanted to gauge interest in smoke-free conservation area policy development with our staff, as well as the needs of staff to be able to support policy development. So we conducted a survey with public health units, and 33 of the 36 public health units indicated interest and commitment to work with their local CAs on smoke-free policies and a need for support resources on smoke-free conservation areas policy development. So the interest and need from Conservation Ontario and conservation authorities, coupled with the interest and need from public health units on smoke-free conservation areas policy development, led to the development of the Smoke-Free Conservation Areas Toolkit. And with that, I will now hand over the presentation to Jenna, who will present on the Smoke-Free Conservation Areas Policy Progress Tools.
Thank you, Samiha. So the goal in the creation of this tool was to have a way to demonstrate progress in the work that we do come reporting time, and how we wanted to articulate this was in percentage form. So for example, our objective could be to progress towards policy development by about 20% by year end, and these 100 steps in the tool convert simply into progress percentage points.
Thank you.
Next.
I just want to remind people, don't forget to mute your telephones, please.
Thanks, Jane. This gives you a glimpse of what the tool actually looks like. It shows you how the steps are laid out on the left in the color-coded sections. Status and timelines are recorded for each step on the right. And with ongoing charting in the blank text boxes, this allows us to record and convey any details or variances along the way. Next. Where possible, we actually tailored sections within the tool to be specific to working with conservation areas. Next. This gives you a glimpse of what the sections look like once they are pre-populated with information specific to CA work. Next. As an internal working document, it guides any policy change project and captures the progress to facilitate reporting. So basically, the tool allows for ongoing charting of the progress within each of the steps. And the user assigns a status to each step, be it not applicable, in progress, incomplete, or complete. Next. This tool encourages a comprehensive and consistent approach to policy development. However, it does acknowledge that there are many valid and appropriate approaches that one can take within each step. So for this reason, certain steps link directly to specific supporting tools, while other steps don't. But there are supporting tools and documents available for download on the additional support page of the website where this tool is housed. And should there be turnover, or should the policy work be taken over by another staff, then this tool offers a way to look back on the work that's been done and continue the progress. Next. So there may be wide variation in the amount of work necessary for each of the 100 individual steps. Likewise, no two public health policy change projects will require the same amount of work. For example, in some projects, the stakeholder recruitment steps may be the heavy work, while in other projects, it may be the education piece that is the heaviest. So this tool doesn't assign importance to certain steps over others, but rather it is simply designed to offer public health staff a way to show progress in the policy change process using a charting system and 100-point checklist system. This allows them to track their progress towards 100% completion. Next. In order to measure progress, we need to know what we're measuring. So when developing this tool, the steps required to achieve policy were grouped accordingly into process themes. This became their process category. Those working in public health policy development constantly adapt to changing situations. And we know that policy development is not a linear process, so likewise the steps presented in this tool are not strictly meant to be followed in the order that they appear. It may also mean that actions within multiple steps might be ongoing simultaneously. Next. There are several steps within each of the process categories, and not all categories have the same amount of steps, but each of the steps contribute to the purpose of that category. Next. So within public health priority setting, these steps help us see where the issue stands in terms of internal public health unit priorities and operational plans. So if you're working with a public health unit, these are the folks who would be completing this section. Next. When looking at the internal public health needs assessment, we want to know that if this is enough of a priority to move forward, then is there public health unit staff capacity to work on this or to support CAs throughout the process? And is a policy the appropriate way to address the issue? So again, if you're working with public health units, they would be the ones completing this section. Next. Now that we know what it means for us at the public health unit level, we need to explore what it means to those in the community. So this is the external needs assessment. Who the community is could be the general community we serve. It could be the conservation area that we're working with, the school community who's living a certain identified problem, could be a sports association, municipality, or whomever. Next. When policy planning, it's important to know where you're going with the policy change project, but remain flexible and adaptable. So it's important to recognize that from a public health unit perspective, your goals and objectives may not be the same as the goals of the community or the conservation area in this case. So this can have a significant impact on how the pace at which the project evolves. So an example of differing goals may be my public health unit goal is to prevent exposure to product use and grow the areas that are protected by smoke-free policies, while for the CA community that I may be working with, their goal may be to increase their image as a socially or environmentally responsible community leader. Next. When thinking about policy readiness, it's really just to ensure that the policy project is realistic and that it remains relevant to the community. Next. The target stakeholder engagement strategy is to allow an opportunity for those who are living or impacted by the identified problem to be heard. Next. The policy development strategy tailors the policy solution to the community based on what you've learned and gathered throughout the process, and we remain adaptable to the changing situations. Next. The education and awareness strategy allows us to use common messaging and understanding. So this is about creating a sense of normalcy about the change. Next. The implementation strategy simply brings the policy into effect and gives credit to the adopters. Next. Evaluation throughout the project allows us to know if the policy is effective in responding to the identified problem. Next. And at the end of the tool, there is a section for a summary report. Next. This is also where we find the totals or percentages by status. So a completed tool offers background details about the project from start to finish. And with that, we're able to pull lessons learned. Next. Because we're working with a Word document, we are talking about a manual calculation, but given that there are 100 steps, this converts quite easily to percentages. And so here's a very basic example. Let's say that at the end of year 1 of a 2-year project, you have 10% in progress, 70 complete, 10 incomplete, and 10 not applicable, which means that you've considered them but have since considering them deemed them not appropriate or not necessary. This would indicate basically that there has been a 90% progression in year 1, only 10%, because only 10% of the steps were untouched or incomplete. Next. And this would mean that in year 2, you'll be aiming to move the remaining 10% from in progress to complete, and to move the remaining 10% from incomplete to complete, or not applicable if that's the case. So this would indicate that you have a 20% progression rate in year 2 because it is 20% of the steps that had a change in status. Next. That said, we're basically calculating the percentages or how many out of the 100 laid out steps have experienced a change in status since the last reporting period. So year 2 had 20% progression rate, but a 100% completion rate by the end of the 2-year project. And now I'll hand over the presentation back over to Samiha, who will explain how to access the Smoke-Free Conservation Areas Toolkit.
Yeah, I think someone's getting a call.
There's some background.
Mute their line.
Oh dear.
It sounds like someone
walked away.
This might be problematic. Jane, can you still hear me with the background music?
Yeah, just go ahead, Jenna. Sorry.
Okay, well, I've got mood music now for the rest of my slides here, which we can work with. Oh, maybe not. Okay, well, thanks, Jenna. So the policyprogress.ca is the website that houses the Smoke-Free Conservation Areas Toolkit, which includes the Smoke-Free Conservation Areas Policy Progress Tool and a number of support resources. The website is password protected, and we have provided you with the password. I did want to spend some time just kind of navigating through the website just to show you where things are located.
Sorry about that.
Sorry. Yeah, that's all right. Sorry, I don't have it. Not responding. Okay. I can't seem to be able to put that one.
There we go.
There we go. Okay. So just let me. So the website is password protected. So when you come onto the website, you just want to put East TCAN policy, and you'll be able to access the website.
Sorry, what was that password?
Sure, it was East TCAN policy. It was on the slide, the previous PowerPoint slide there as well. So, okay. But if you just want to go over to under areas of focus for healthy public policy. And if you scroll down through here, you will see a conservation authorities area, so this will take you to the toolkit. So this is sort of the home page, and here you'll find a number of resources. So I just wanted to showcase a couple of things. I've sort of queued some of them up. The first one being the Smoke-Free Conservation Areas Policy Progress Tool that Jenna just chatted about. So as Jenna discussed, the progress report columns have been left blank, so you can input your progress related to the work. And relevant links, documents, and templates have also been hyperlinked in the tool for your quick access. Also on the website, you'll find the Public Health Unit contact list. Public Health and CA contact list. So if you are interested in smoke-free conservation areas policy development and are looking to find out who best to connect with, this is the list that you want to be referring to. A policy tracking database has been built into the contact list. So this will be updated periodically by our working group and uploaded onto the Policy Progress website. So you'll have access to the most up-to-date list. The great thing about this contact list is that it can provide you with the opportunity to network with others who are working on smoke-free conservation area policy development. We also have on the website our social media document, and it kind of looks like this. So the social media document has pre-developed tobacco and environment messages that you can use and adapt to complement any of your policy-related education awareness initiatives. We've also included suggested health promotion and environmental awareness dates, so they're available there as well. And more recently as well, we developed, as a working group, an infographic for the general public on the benefits of smoke-free conservation areas. So that's available to you. And we are actually in the process of, right now, of developing an infographic on building the case for smoke-free conservation areas. And the target audience for this infographic is for CA board members. I know this was addressed as a need from both our CA and public health unit partners. So once that's developed, we will upload it onto the policy progress website. So this toolkit is really a dynamic document. As more CAs and public health use it, we will be uploading additional support and sample resources so that you have access to that. And that takes us to the end of our presentation. So thanks very much.
Thank you very much. Now, are you able to move the administration over to Kevin?
Let me see if I can find Kevin here. Or I've just handed it back over to you, Jane, because, oh, Kevin's got it. Okay, excellent.
All right, can people hear me okay?
Yeah.
All right, terrific. Okay, so I've been obviously asked to speak to this presentation regarding our experiences as the Essex Region Conservation Authority and how we went through the process of going through this and developing smoke-free policies. Our policies and processes predated the great tools that have already been shown here, and just based on what I just saw and witnessed, I'd suggest that people do use those as a path forward. All right. In 2003, we were approached by the Windsor-Essex County Health Unit with a question: do you want to, or are you even able to ban smoking in our conservation areas? From this initial email and request, we had some additional meetings with both the health unit as well as some internal discussions to figure out if we wanted to initiate this, and if so, how. Our region, not unlike any other, is made up of places. It's where we live, where we work, and where we gather and where we play. We give meaning to these places based on how we use them and appreciate them. You become attached to these places, and they become important to us. And as a result, we have an obligation as a conservation authority to protect and preserve those places. Within our region, it's the Essex region, and everybody has their own place. So we have a responsibility to help and protect this region and our community and ensure that the place that we live in has clean water, landscapes, and we support healthy living through recreation and conservation. So it's for these reasons that we did get behind this policy direction many years ago that restricts smoking within our conservation areas. So one of the things I'll go through now is some of the things that we've discovered and found out. Some of these stats are a bit dated now, about a year old. But ultimately, there's a huge amount of societal cost associated with smoking related to hospital care, physician care, fire damage, and we've seen some of that stuff down here, absolutely. And our preference as a conservation authority would definitely like to see these types of funds invested into other programs and processes rather than into smoking. Benefits of a smoking policy. We saw a number of benefits associated with the smoking policy, and these are the purposes and rationale behind we chose to proceed in this way. Reducing health risks, obviously, from secondhand smoke is definitely a high one. And what really struck with our board of directors also was denormalizing tobacco use. Which means that if youth don't see other people smoking, they don't think it's normal. They don't think it's the right thing to do ultimately. And hopefully the youth don't get into smoking anything related to tobacco specifically. Healthier environment. We do beach cleanups along our various beaches, as do many other people, many other conservation authorities. And cigarettes are one of the number one pieces of litter recovered on the beaches. And I have talked to visitors who have had their children pick up cigarette butts and play with them and this and that. So obviously we don't want these types of things littering our beaches. So that's another benefit to this smoking policy. The picture to the right is Hillman Marsh Conservation Area. That's one of the conservation areas that was lit on fire due to a careless cigarette thrown out of the side of a vehicle. We've had a few fires, and especially if you're within a region of Ontario that has a high density Phragmites stands within your wetlands, you have an even higher probability of having this type of an event occur. These are things that we deal with and have to continually deal with as it relates to cigarettes. So the smoke-free outdoor spaces policy, we did this within all of our conservation areas. We phased it in over a 2-year period. Ultimately, we prohibited smoking, except in a few designated areas. The designated areas for our purposes were campgrounds, because those are livable spaces for people. So within individual campsites, and within our larger conservation areas, we had specific designated areas that were away from the main hubs of activity where somebody was allowed to go and smoke, and there we put up a picnic table and an outdoor ashtray for them to use so that they could smoke responsibly. And then beyond that, we, in our smaller conservation areas where our day use facilities where you have just a parking lot and a trail, what we did was we just said you have to keep your smoking to the parking lot. You're not able to smoke while using our trails or our natural areas. We implemented a very large media campaign associated with that to educate the public about it. We put up signage in all of our conservation areas associated with this. We did work with the local health unit to train our enforcement staff related to tobacco compliance. And we worked in partnership with them to have them actually come in and do some education and of our clients if they encountered anybody who they found smoking. And finally, we did a very detailed evaluation plan that was completed to understand if the policy was actually working or not. So here's an example of one piece of it. This is a screen of all the signage. This is our region, Essex Region, and some areas where we had to actually think about putting up signage in our public areas where we have various trails and parking lots to let people know that smoking wasn't permitted in these areas anymore. So the signage that went up looked like this. So we had 4 different signs associated with the smoking policy. We had no smoking beyond parking lots, smoking permitted only in designated areas, designated smoking areas, and then we had a park watch system. So part of this process was to develop a way to deter people from smoking and to actually track to see if the public was going to complain about people smoking. So we developed a system where people had a toll-free number to call, as well as an email to email people complaints regarding this. So phase 1 of this policy entailed all those things that I've just described: the park watch system, public education campaign, and a lot of literature changes to things like our hunting blinds, as well as our various campsites. And then we had to do the evaluation, review any enforcement issues, and do a fairly detailed cigarette litter audit. And the local health unit was actually great. They actually brought in some additional resources and students to do surveys and various other things as part of this entire process. the outcome of this was that we didn't really have any enforcement issues. We didn't have any complaints filed with either our Park Watch system. Our staff did not have have to write any tickets. We had compliance when the occasional person was found smoking within our conservation area. And overall, it was a very smooth process. And we've been doing this for a number of years now, and that continues to be the case. Some of the research associated with this policy shift is just this, that 97% of the people who were interviewed as we were implementing this policy change said that they would either not be affected, they'd be more likely to use a conservation area, or they didn't know. We only had 3%, say that they didn't want to use a conservation area if we implemented this policy. So the numbers were resounding. Let's move forward and implement this within all of our conservation areas. Recently, with changes to the legislation, we've had to do a policy update to our existing smoking information and policies. So now our original policies spoke specifically to lit tobacco products, but now our policy actually has been expanded to smoking or vaping cannabis, electronic cigarettes, hookah, and water pipes, or consuming or smoking any other type of substance within our conservation areas to try to cover off on the variety of things that people are actually smoking. And that brings me to the end of my presentation, and I'll be happy to answer any questions.
Thank you, Kevin. That was great. Just before I ask for questions, I'm going to mention one thing, and that's that the Upper Thames Region Conservation Authority also just announced that they are having 3 of their conservation areas smoke-free, and that would include Fanshawe in London, Wildwood in Woodstock, and Pittock in Woodstock, and Wildwood in St. Mary's. So all forms of smoking are prohibited in all public spaces within those 3 conservation areas. They are permitting smoking in a registered campsite or in a designated area. So according to their news release, they've created the designated areas. They have a map that shows where people can go and smoke or where they can't smoke. And so I think that's another step in this direction. And just to let people know, we've been working with the conservation authorities over time, and there are other conservation authorities who are also working in this direction. So unless the presenters had any last-minute comments they would like to make, okay, let's open it up for any questions there might be. Any questions at all? I have one, if you don't mind. Samiha, I wondered if you could you or Jenna could just tell us what you mean by smoke-free. Like, what are you referring to? It's not just cigarettes. What does it cover?
Yeah, it could cover a couple of things. I know folks have created policies to be inclusive of all forms of tobacco as well. So your smokeless forms of tobacco, like chew tobacco. I know some people have also included the vaping devices, electronic cigarettes. We're starting to see a huge use of it and probably hear a lot about it in the media. So folks have included that in their policy, as well as cannabis. Cannabis has seemed to be the catalyst for, entertaining the idea of developing these policies as well. So,
okay. Are there any questions for the presenters?
Hi, it's Kate at the Asabo Bayfield, and I guess a couple of questions for Kevin. What sort of time span did you take to from starting to develop the policy to starting to implement? And I know you had a trial period.
Yeah, I'd say it took about a year to actually fully do. The first thing that we did was we went to our board and just informed them of the opportunity itself, and said, you know what, do you even want us to go down this road? and if it was a hard no, that would have ended it. But we didn't get that. We definitely didn't get that from our board of directors. So there was an interest and there was an acceptance that we wanted to go down that road. And it probably took about a good year to actually develop the actual policy framework, to start doing the survey work, and figure out exactly how we would actually implement it, because each conservation authority has a different suite of lands, have different areas, and how you would actually implement it within each one of your conservation areas is determined by the nature of your conservation area, and many have many conservation areas. So those are the types. You have to look at your operations, what you do within your conservation areas. Do you allow camping? Do you allow hunting? Where are your public access points? Where do you put up all that signage? Those types of things. So it took about a year to actually work through all those details, picking away at it, before we were ready to take it back to the board. And then we did a 2-year phase-in. We did all of our major conservation areas in year 1. And then based on the success of that, we implemented it for the remaining conservation areas in year 2.
Did you have another question, Kate?
Yeah. So Kevin, in terms of your budget and that, could you give me a ballpark of how much staff time it took to go through the process of doing this?
That's a good question. The health unit was very supportive, and they actually covered the cost associated with the initial rollout of materials and supplies, and did tobacco compliance training for all of my staff. So they covered some of those upfront costs. In terms of staffing costs, really it was the director of communications and myself working on it. We didn't count our time towards it or figure out how much time we spent on the project. But if you add it all up, definitely 2-3 weeks at least, if you actually sit down and probably add it up.
Okay.
Are there any other questions? All right, so I think we'll close it off then.
Kate?
Yes.
Byron here from NBC. Sorry, I was muted there.
Okay, go ahead, Byron.
A question on, I guess, any support from the health unit. Kevin received some, and I just wondered, does any of that exist currently? Like training or any other kind of resource?
Samiha, do you want to try and tackle that one?
For sure. I think it'll be public health unit dependent. So as I shared earlier, we have that public health unit conservation authority contact list. So if you want to sort of take a quick peek to see who your contact person is from the health unit, to sort of have those conversations to see what kinds of supports they're able to provide. That probably would be my suggestion. If you need some support in locating who your public health unit contact person is, feel free to either connect with Craig or myself, and we can definitely get you that contact information so that you can have those conversations with your public health unit.
Okay, any others?
Just one more question from Kate. The slide deck, when will it be available for us?
We can put it up on our, if you don't mind the music in the background for that section, we can put it up on our YouTube right away. Okay, otherwise, if it's all right with Samiha, I can share out the slides. But Samiha, what do you think?
Yes, absolutely. Jenna and I are happy to share our slide deck. We can send it to Jane so that she can share it with the rest of the group. Okay, perfect. So if anyone wants a copy of the slide deck, just send me an email. It's Jane Lewington. And so my email is jlewington@conservationontario.ca. And in the meantime, we'll go ahead and put it up on the YouTube channel. And we'll send out to the same contact list that we did for notification of this webinar. We'll send out the information, the link for the YouTube. So if that's it, I guess we'll say thank you very much to everybody. Sorry about the little glitch there, but I think it went pretty well otherwise. And we'll talk to you all later.
All right. Thank you.
Thank you. Bye.
The leader has disconnected. The conference will be terminated in 5 minutes.